Hello, dear TV friend, and welcome to another edition of your program Women's Voice on Divine Mercy Radio Television. I'm sure throughout the month of October you have been hearing a lot about breast cancer, how raising awareness, what it is about, but have you ever bothered to find out what it takes or how to take care of your relative who has been diagnosed of breast cancer? On today's edition, I'll bring to you interesting conversation with someone who is surviving or who is living or who has surpassed that step, and with a medical doctor who also enlighten us on what breast cancer is. All of this is put together on today's edition of the show Women's Voice. We are out here to throw more light. We want a lot of social media is flooded with a lot of quacks and misinformation as far as breast cancer is concerned. So do not move a muscle. We're going to discuss living with breast cancer just throughout this program. Let's have this first transition, and up next I'm going to introduce you the persons with whom I'll be having this conversation. Let's have this transition. You're welcome back, dear TV friend. You're watching Women's Voice on Divine Mercy Radio Television. And Women's Voice is a program that comes up every Thursdays from 5 to 6 p.m. on Divine Mercy Radio Television, where we talk gender-related issues. We raise awareness, we promote good practice, and also we try to give proposals as how best we can fight or we can end gender-related issues. Also talk about health issues. That's why on today's edition we're looking at breast cancer. I'm sure you have seen a lot of videos, you have heard from the news. It is a pink October. Now we want to have this discussion to have an understanding what is breast cancer. I'm sure you have had a lot of information and also misinformation about what it is all about. And now today we're talking living with cancer. We have someone who have gone through the different steps, who have been diagnosed and also lived with it for some time, but now she feels much better. So she's going to share her experience with us. And I just want to say she pleaded for animosity, so we're not going to show her face. She's going to share her conversation with us. And thank you so much. We're going to call the person Lady T on the show because she doesn't want to be to be known. So good evening, Lady T, and thanks for joining us on today's edition of the show. That is your name for today, Lady T. Good evening.
Good evening, viewers of Divine Mercy Radio and Television.
All right. We're going to have more from her. For some reasons, she decided not to. She wanted to share her story, but doesn't want to put a face to the voice. But she wants to inspire someone out there. And in the course of the program, we'll know why she doesn't want to make to show us her face. So I'm also joined by a medical doctor who is going to share with us. He's going to give us, enlighten us about breast cancer, and also maybe tell us how we can journey with our relatives who have been diagnosed of breast cancer. I am talking about Dr. Chenjo. I hope I got that correctly. Dr. Chenjo William, who is joining us on set this evening. Good evening, doctor, and thanks for honoring our invitation.
Good evening. It's a pleasure being here once more.
All right. These are the people with whom I'm going to have this conversation. To kickstart immediately, doctor, what do we call cancer? When we hear cancer, before we go to breast cancer, what is cancer?
Cancer is just the abnormal proliferation of cells, and those cells have the potential to invade other neighboring structures or tissues in the body.
Okay, so now when we talk about breast cancer, what are we referring to?
That means abnormal proliferation of breast cells. That's just what it means.
Okay. That's some abnormalities at the level of the breast cells. There's tissues in your breast. Okay, now, doctor, we have a lot of information. People have spoken so much, raising awareness about breast cancer and all the tips. And basically, I want to find out at what level or what will determine or will inform you that someone has a tissue or maybe a breast cancer.
Now, the first thing is breast cancer comes with some symptoms, but some people will be asymptomatic, meaning they will not have any symptom, and the lesion or the cancerous cells will just be discovered accidentally.
Okay.
Now, for those who have symptoms, they can present with a breast lump. That's the most common presentation. A woman will complain, I have a lump in my breast. That's the first presentation. Others will come with pain that their breast hurt. Others will complain of milky discharge or bloody discharge from the breast. Others will tell you they have a lump beneath their armpit.
Okay.
And others will say the skin color around my breast has changed.
Wow.
So those are the presentation people come with.
Okay. Now, I want to ask you, Lady T, how do you get to know that you have breast cancer?
Yeah, thank you. I had no sign, I had no pain. One day, as in the night, I just felt aches all over my breast, and I was out of town. I wasn't in Buea. I was in Douala. So I called my auntie attentions, and I told her I had pains on my right breast and it's really persistent. She palpate the breast and check whether there's anything there. She find none. Like Catholic Christians that we are, she said, okay, I should take some holy water and drink and apply some on the breast. I did that and went to sleep. The next morning, I was in the bath to bed. I was feeling my breast, then I felt a nodule on my breast. So I called my auntie's attention. I said, okay, it means either the thing was like struggling to gather itself, that's why it was like aching or something. But we thank God that it gathered, and immediately I left Douala back to Buea and went to the hospital where I consulted a gynecologist, and he sent me to do a biopsy. Took the results after 2 weeks, and the result, they just said there were some irregular cells in my breast, and I was not satisfied with the result. So I checked another hospital. I went to Douala. I did mammogram, I did breast ultrasound. I came back with the results. My doctor told me the results said the same thing. So now he said, okay, he will send me to Yaoundé to visit some doctors there. That they will better further some other tests and let's see what comes out. So he sent me to Yaoundé. I was supposed to meet with one doctor there. I went, he gave me his number. He was not on seat. I called him number until he was not going through. I called him back and said, the number you gave me is not going through. He said, okay, he has a team he's working with. He sent another number that I should call the number. I called. It's a female doctor that picked it up, Dr. Ngasam. So I introduced myself to her. I said, it's Dr. Clifford Ebong. She said, yes, doctor just called her and informed her about me. So she gave me an appointment the next day. I met her. We went to one clinic that she's practicing at Bastos. We went there. She checked me and called some other doctors and said, I had a client here with me. She explained my situation. She said, but the thing is it's not fixed. The nodule is not fixed.
Okay.
It's flexible. So she did not know, she don't know if it's cancer or something, but since Dr. Ebong has sent me to her, okay, she will see what to do, but she cannot work with me alone. She will call other doctors that they have their team. So I went back home. She called me the next day. I met her with late Dr. Fongang. He died.
Okay.
So I met her with Dr. Fongang. Dr. Fongang checked me too and said, okay, he is going to do a surgical biopsy. He will not operate the breast, but he will make an incision and send a machine inside that will pick up specimen from inside the breast. He did the incision and sent the machine, picked up
Just so the local person understand, incision, just give that description. What was the incision? How
It's a
does it-
cut.
Okay.
He made a cut with a surgical blade.
All right.
Yeah, he cut the breast with a surgical blade. Then send out the instrument inside where he has cut. It's electronics. I like he's pressing. It then is going right inside my breast until he reach where the lump is.
All right.
Yeah, but he just like he gave local anesthesia under my breast. So when he finished, he gave me the specimen and said I should take them to Central Pasteur.
Central Pasteur.
Yeah. So the next day, I asked him how much. He said he did not know how much it was going to cost, but I
Okay.
paid him 60,000
Okay.
for this one that he did. So I said, okay, since he did not know how much it is going to cost, I went to Central Pasteur. I said, let me do the findings. I went there. I said, I have this specimen that they have sent me with a note. I presented to them. They said the test is 120,000. I said, okay, I had the money. I paid. They gave me 1 month to come back for my results. So I called Dr. Fonga. I said, so how is the result going to look like? He said, okay, if the results are out, if the nodule is cancerous, the result is coming with a form of treatment that I may take. Either it's radiation or chemotherapy. But unfortunately, before the result could come, doctor died. He had an accident. He was alone in his car driving to the village.
Sorry about that.
Yeah, he died.
Okay.
So I went back to Dr. Ngassam. Dr. Ngassam said I have to pay her 5,000 francs before she could interpret the results to me. I had no choice. I paid her the money. She said the results said irregular cells. I said, doctor, okay, all along it means it's cancer, but right now I want to know the stage, because even if this result is coming from France or wherever that they carry the investigations, he has to state something on like the stage or the particular stage that the cancer is. He said, but they did not mention it. I said, okay, the other thing that Dr. Fonga told me was, if it's cancer, it has to come with a form of treatment. So which one is mentioned here?
Okay.
She said, no treatment.
Okay. Just let me I want to find out from you.
Yeah.
When you got the news that it's cancer, how did you feel?
That same day, before I even went to Yaoundé, here in Buea, I came back to the house. I cried like for a week. I just sat alone. I imagined my child. I imagined many things. So the fear of cancer, like what I've been hearing, cancer cells, cancer will just kill somebody, it will spread, it will this. So this how I'm just going to die. I took like a week before I could tell even my family members.
Okay.
The only person who noticed the difference in me, like I was so confined, is my neighbor.
All right. Now I'm going to come back. Doctor, she has given us the procedures that she went through before they could tell her that it is cancer. Was that the appropriate measure? Is that how normally it's supposed to go?
Now, to diagnose a cancer or cancerous cells, the only thing you can do is biopsy.
Okay.
Now, there are many other tests you can run that will just tell you the stage of the cancer or the probability that the lesion you have is a cancer. Like she mentioned a mammogram. A mammogram is just going to tell you have a suspicious lesions and where they are located and how many of them are present. Okay. That's what a mammogram is going to tell you, but it will not tell you this is a cancer.
Okay.
A breast ultrasound will do the same thing. It's still going to tell you there's a lump here, there's a lump there, there's a lump here, but it will not tell you if it's cancerous.
Okay.
So the only way to diagnose a cancer is to do a biopsy, and the biopsy will tell you it is cancerous or not. Now, just to come to what she said, breast cancer, there are multiple types. There are those that are hormone sensitive and those which are not hormone sensitive. Okay. So when they do a breast cancer biopsy, the biopsy will tell you these cancerous cells are hormone sensitive and this is not hormone sensitive. Now, generally, hormone sensitive breast cancers are better off than hormone non sensitive. Okay. When it's hormone sensitive, you just have to get rid of or reduce the estrogen or give estrogen blocking drugs, and that's it. It usually resolves.
Okay.
But when it's not hormone sensitive, then they're usually very aggressive and the prognosis or your chances are generally poor. Okay. Perhaps that's what the doctor Fonga meant by saying it's going to come with the treatment or so. It's based on whether it's sensitive to hormone or not.
Okay, when we say sensitive to hormone, which means that maybe your natural the hormones which your body produce are actually the cause or facilitate the process.
Correct. Now, estrogen plays a very great role in breast development in women. Now, when they're hormone sensitive means they have receptors to estrogen. So each time estrogen binds to it, it will tend to multiply even faster. So the treatment they give, they just block the binding of the hormone to the cancerous cell, and the cancerous cell stops dividing or start dividing slowly and slowly and slowly.
Okay, so doctor, with your experience, how most often people, maybe you've had to tell a patient that he or she particularly is suffering from breast cancer. What has been the reaction that they always have?
Now, the first thing is there are two schools of thoughts. Let's just get to that.
Okay.
Back then in Nigeria, in those days, they prefer not telling patients when they have a cancer, because they found out that when you tell a patient you have a cancer, they tend to be depressed and they tend to get worse.
Okay.
Then those who were not told and were just managed like blindly tend to live happily and longer. But now that is unethical presently.
Okay.
A patient has the right to know you have these, and you have to be truthful to the patient. Now, when it comes to breast cancer, to always open up and tell the person you have a breast cancer is not easy.
Okay.
What is advice is you tell the patient to come with somebody very close to the person before you disclose both of them at the same time. So the other person will be a support
Okay.
to the patient with cancer. So the reaction is generally first denial. Most patients say, God forbid, it's not my portion, it's not this, it's not that. That's what most will say. Now, you have to calm down to tell them, okay, this is what your results are, this is what they say, and these are your chances. And you try to convince the person it's an illness, a disease like every other disease. If it's handled early enough, you have better chances. But their first reaction most of the time is denial. It can't be me.
Yeah, we think it maybe is associated with with the fear that once you hear cancer, it is death. But I think that, doctor, not cancer. Cancer is not like, not all cancers lead to death. So there's a possibility. That's why we have someone here to instill hope that you might be diagnosed of cancer, but you're not going to die. Is that very possible?
Very possible. It is. She's an example of
She's an example. That's why we are here, to inspire hope to anyone who is out there suffering with cancer of whatever form. There is hope, but today we're focused on breast cancer. Now back to you, Lady T. When you got the news finally that you've been diagnosed, after all the process, and you said you've told us that you received it with so much shock. So how did you manage to finally put yourself together and accept that, fine, this is it?
All thanks go to my good neighbor. Her name is Sheila. She noticed I've been confining myself in the house, because I'm that one person who, when I'm around and she knows I'm around, I know she's in her room, I'm always there, or I will shout her name. Like for a week, I was like, Sheila, good morning. I just went back in. So she came one day and said, Auntie Susan, I've noticed something. What is it? I said, Sheila, it's nothing. She said, no, you have been crying. Look at your eyes. Your eyes are swollen. What is it? I opened up to her.
Okay.
I said, okay. I've been diagnosed with breast cancer. She said, no. Don't be afraid. It's you who is giving me inspiration. It's you who is always giving me encouragement when I'm passing through a difficult moment. So why is this one happening to you? Where is your courage? She talked to me, and I just stood up. I sat up. I said, it's true. Okay. She counseled me and talked. And she asked, have you told any person in your house? I said, no. She said, no, call your elder sister and tell her. I called my elder sister. I said, how are you? I said, I'm not fine. I said, what is it? I said, I've been diagnosed with breast cancer. She said, what? Breast cancer? When? I said, last week. He said, and you are just informing us. I said, in fact, I never knew how to break the news to any other person.
Okay.
She started quoting instances. You saw this person, they cut off her breast, she still lives, and until now she's still living. She encouraged me that I should not be afraid. I said, okay. So what am I going to do? I said, for now, nothing, but I've called my doctor in Shisong, and I told her everything. She said, okay, I should just be courageous enough nothing. They'll put me into prayers. I called my elder brother. I informed him. He said, have you told anybody? I said, only sister. He said, okay, don't tell anybody. We'll know what to do.
All right.
So I went like, all of them he said I should just calm down. I should not be afraid.
Okay. All right.
But
So,
I should avoid sugar. That was the first thing he told me. I said, okay.
Okay, fine. Which means that you had a lot of support. Once you were done, you shared that you had a lot of support from your friends and loved ones.
Yes.
So now, doctor, we want to talk about those who are living with cancer already that have been diagnosed. How should their relative treat them? Or how important is this support they need from their relatives?
Now, with cancer, one of the most important aspects of the management is the mental health.
Okay.
Mental health is very, very important. If you have cancer and you're depressed, your condition will not get better. So you need people by your side to help you, strengthen you in your weak moments. Because it's a disease that is going to take a while for you to recover. And it's really, really a serious problem. And if you're all alone, you will not be able to make it generally. You need people to stand by you. When you're weak, they're there to support you, to help you, and to make you feel like you should fight. Life is worth living. On your own, you'll not be able to face all of that. So people by your side are very, very important because it's a long road and you need those people to carry you to the end point.
Okay. So now I'll still remain with you, doctor, before I go back to Lady T. Generally, once you have diagnosed, a patient has been diagnosed and it's confirmed that it is cancer, usually what stages determine what kind of treatment they are exposed to?
Now, the staging is very important. All cancers, not just breast cancer. The staging just tells you the size of the tumor is going to tell you if there are distant metastasis, for example, if they are spread to other areas, and the number of lymph nodes involved. Now, the staging tells you your chances, your prognosis, your chances to survive, and the therapeutic options you have at hand. So if I have a breast cancer that is just on my breast, does not spread, most I tend to do surgery. They cut off the cancerous area. They can do total mastectomy, that's they remove the whole breast, or they do partial, they just move part of the breast and allow the rest. Now, if it has spread to maybe a regional lymph node, they can still do mastectomy, they remove the breast, but now they have to do radiotherapy or chemotherapy to destroy the other cells that have spread. But now for those who have spread aggressively and it's all over your body, now chemo, radio, and mastectomy will not be helpful in such a person because the lesions are everywhere. You will not be able to radiate the whole body, and chemotherapy drugs are really, really cytotoxic. They destroy both good cells and bad cells. So when they give all of that, you have a very poor quality of life and the events, the outcome will still be the same. You're still going to pass away. So in such patients, the privilege you having a certain quality of life for the short duration of time you have. So they just do what they call palliative care. They just manage your symptoms while waiting.
Okay, so what's the secret to winning cancer?
Early detection. That is it. If your cancer is discovered early, the treatment is better and you have more than 90% chance to survive. Late is very poor and your chances are very, very, very slim.
All right, thank you so much. If you're just tuning in, you're watching Women's Voice on Divine Mercy Radio Television. And today we're talking about living with breast cancer. We've had a beautiful conversation so far. In the meantime, you can have questions you want to ask either the survivor or the doctor as far as breast cancer is concerned. In the meantime, let's have this short transition. We will be right back. Welcome back, dear TV friend. If you're just tuning in, you're watching Women's Voice on Divine Mercy Radio Television. It is a program that comes up every Thursdays from 5 to 6 p.m. where we discuss issues related to gender. It is a program about women, but not just for women. And on today's edition, we are looking at breast cancer. We have a survivor who is sharing with us her story, and a medical doctor who is here to enlighten us and also educate us on how to accompany our loved ones as far who have been diagnosed with breast cancer. We continue the conversation here on set, doctor. Once a patient has maybe gone through this or is going through this different forms of treatment, irrespective of the stage, what is expected of either the family, or what is expected first of the patient and the relatives of the patient?
Now, with breast cancer management, as I said earlier, you have the mental aspect, you have the medical aspect of it. Now, let me come to the medical aspect. If it's a mastectomy that's cut off your breast, now you have to tell the patient you don't have a breast anymore. The patient should come to terms with the fact that the breast will have to be removed.
Okay.
So counseling is very important. So you tell the patient your breast will be off for so reason. So if the patient is accepted, like the patient has to know the implication of losing a breast and has to come to terms with it. Secondly, chemotherapy and radiotherapy are heavy treatments. When I mean heavy, as I said, they destroy both the good cells and the bad ones.
Okay.
So when you have to start chemotherapy and the radiotherapy, you tell the patient, okay, you might lose your hair. Your hair might start falling off. So if your best part of your body is your hair, you have to come to terms that your hairs will not be there anymore. Taste will be gone. You'll be having funny metallic taste. You should be able to accept all of those. You'll be losing weight. You should be able to accept the fact that you'll be losing weight. Your skin color will change. You should be able to accept that. You'll be vomiting. You should be able to accept all of those. Okay. So those are heavy treatment, and the patient is acquired too. Know that this is what she'll go through, and she should be able to accept all of those, not to lose hope at a certain point of the treatment. Okay. Now, for the mental health aspect, now it has to do with the way the family perceives her illness, the kind of support they give to her, and the way we healthcare practitioners equally portray things to her is very important. Mental health is a certain domain that we neglect a lot, but it's something which plays a lot on the outcome of a disease on the patient. Just the fact that I come to a patient and smile is already enough to make the patient know, okay, well, I will survive, I need to fight for it. But if you come with a kind of a face, the patient know, okay, I'm dying, and it's going to make the patient get worse and might end up dying. I can just share a little story of a patient with breast cancer I received some time back at the hospital. She was diagnosed with breast cancer in Nigeria. They offered her mastectomy to remove the breast. She refused. The doctor said, okay, we can't do anything for you if you don't want a management. So she came back to Cameroon. On coming back, the cancer has spread.
Oh, unfortunately.
So she came to the hospital. She was really fighting to leave, like really gasping for air. Her mother was by her side. Each time she wasn't sleeping because of the pain and difficulty breathing, because it has spread to her lungs. The mother was there all through. The mother was saying, no, you're not dying. You are going to be fine. Always keeping a very happy face.
Okay.
The girl looking at her mother was saying, Mommy, if I have to survive, it's for you because you are by my side all this while. Even us, each time we get to our room, we all will just change. We just start laughing and cracking jokes just for her to feel like life is worth living. Okay. But when we step out of the room, my half is kind of sad to say, well, she's suffering. But in front of her, we're there for her. So that's an aspect. That's what the carer should do for somebody with cancer. It's not to say, where am I? No, that's not going to help. It's to make the person know life is worth living. Life is worth fighting for. That's what we expect from the carers.
Okay, and Lady T, what was your experience like during the treatment process which we were going through? Did you receive such attention and care from your loved ones?
I received much care till now, up to date. They still care for me. They still don't want me to lack anything. Like, you don't have to stress, you don't have to this, you don't have to. They really don't want me to really stress myself out, because most of my family members are medical practitioners. Okay. Like, they know what I've been through or what I'm going through.
Okay.
But the difficult thing I had was the diet, my diet. I had to change my nutrition. There are many things that till now I'm not eating, and it's like I have to live with that till the day I will die.
Okay.
I don't eat meat. I don't eat fish. I don't eat crayfish.
Okay, and a series of them. You just
many
have
of them.
So have you really adapted? How did you have to accept all of that? How did you manage to finally say, okay, fine, I just have to leave that way after enjoying the sweetness of all of these different things?
Yeah, I accepted it at a point because at the point I would like go back to my normal life. I'll see Eru, I want to eat Eru. I love Eru. And my Eru, I want to cook my Eru with enough crayfish. I want to eat this, but when I eat those things, yes, I had a small pain around my breast. I said maybe my psychologist still working with me or something. So I just decided, I said, okay, I just have to let go these things.
Okay. Oh, all right. So you actually had the support, which is very important, like doctor said, because it catered for your mental health. Now, doctor, I want to come back from you. One of the things I noticed conversing, because I've met a series of women who have gone to the mastectomy, whose breasts have been removed, and who have been diagnosed. Others, not all, actually get to the stage where they get to remove their breast. But talking about this issue of breast cancer, they're kind of a little bit traumatized. And they do not want to even talk because having them come on set was a little bit challenging. What do you have to say? How can we manage that, this stigma which is associated to this disease?
No, I think it's all about health education. Breast cancer, like many other diseases, are stigmatized, but they're like malaria, there is like typhoid, it's like many other things. Everybody could have that. Even males have breast cancer. That we should know. So everybody can have a cancer. A cancer is a serious illness, and stigma is not going to help. Now, cancers and other lifestyle illnesses are the trend of diseases that we're going to face now. Most communicable diseases are already going out. There are cancers, diabetes, hypertension. So we should come to accept that it's a disease, and people who have those diseases should not be stigmatized, but they should be helped. They need the help because they have a long way ahead of them. So we should just learn to know that it's like every other disease, and we should work with those who are sick to get well.
Okay, we should definitely work with those who are sick to help them get well. If you have, just like any other cancer or any disease, it is important, you watching us, it is important that you accompany your loved ones, because just that positive energy which you give them gives them another reason to fight more and fight the disease. Now, I'll come back to you, Lady T. It was quite challenging, I understand. But you have to share with our viewers the reasons why you choose animosity, because we want to understand that wondering they're inspired by your story, how you fought so hard and you survived, yet you choose not to be known. Why did you choose that option? Is it associated to the stigma, or is there any issue? Is there something? What's your reason generally?
Like I told my sister, your colleague, I said, I'm not married. And some people would prefer to get married to an HIV patient than to a cancer patient because they know HIV, the drugs are there. Some people still do not believe that people can survive cancer.
Okay. But you're an example, you have survived.
Yeah, but somebody will not believe. Will say, sometimes if he come back and, So I told her that, I said, okay, I will come, but if only they will not show my face.
Okay, and we had the deal and we respected that.
So I want to tell all the people that are out there watching, maybe they are hearing my voice but not seeing my face, whether you have a lump or whatever, you should never be discouraged. I'm a living example of a cancer survivor. I have coaches that I'm still talking with them that have survived cancer for 30 years, for 20 years. Most of them are white.
Okay.
So whenever like he had anything, he would just send to me on internet, and then immediately I will receive an alert that they are sending me this kind of message, like live like this, do that. He just placed me on a lifestyle that I had to follow.
All right, doctor. After the treatment, the chemotherapy, and maybe those who have their breasts cut off, what is the kind of lifestyle which is, maybe she has mentioned some there, what is the kind of lifestyle which you advise these survivors of breast cancer? How should they live?
Now, the question is why is there a lot of cancer now? It's just what we eat. Now, in many things we eat now, fertilizers, for example, They put in almost all products, and some of their carcinogens, they lead to cancers.
Oh.
Canned food, the same thing. Now, most things we eat now, there are a lot of chemicals there which are carcinogenic. They can cause cancers. Now, people who have cancer, after they have had the chemo, the radio, or maybe the mastectomy, they are very thin. They have lost a lot of weight. They'll need a balanced diet generally to help them recover to what they were before. So after a cancer therapy, they always ask you to have a balanced diet, to live healthy. You don't have to drink a lot. Smoking should be out of the picture. No smoke. Drinking alcohol, generally, they just say no. Water is sufficient. You don't have to drink. And you have a good balanced diet and generally sufficient. But now, after a cancer treatment, they do regular follow-up to make sure you don't have a reoccurrence of the cancer, because that's a risk. The fact that they've done a good job, you don't have any cancer, so does not mean you're not going to have cancer anymore. No. So they do a long-term follow-up. They always go to the hospital. They always check to make sure you don't have any reoccurrence of the cancer.
Okay. Now, Lady T, after through this process, was it costly or has it been costly living with this?
Yeah, it has been costly living with it because I do not take any medication like tablets, or I did not go for chemo. When everything was settled that they confirmed it's cancer, I came and met the bishop. By then, I just stopped working with Catholic Press. I went and met the Bishop Emeritus. I said, my Lord, I had this kind of health challenge, and they are asking for 1 million to remove my breast for an operation. The first thing he says, go to the chapel. In his house, I went to the chapel. He said, I know it's like a surprise. Just go and sit there and be looking at the Blessed Sacrament. I will not tell you what to do. I went into the chapel. About 30 minutes, he came and called me. I came and said I should sit. I sat. He said, I will not go for any operation. That was what he told me. He said, there are herbs that can treat me. I said,
okay, so you used the herbs.
Yes.
Now that leads to the next question. So after the herbs, did you go back for checkup in the hospital?
Every month or every 3 months, I'm waiting for a check.
So when you, after taking the medication, the traditional, the herbs which you were given, when you get back to your doctor and they do the exam, what did he say the first maybe 6 months which you took that?
Well, the first thing when he said it's cancer, I said, God will heal me. So when I went back with my results, he said, what happened? As I told you that God will heal me. He said, did you go for chemo? I said, nothing. I said, herbs. God has blessed us with herbs. And I took them with faith.
Okay.
Yeah.
All right. Now, doctor, this is one of the exceptional cases that we have here because of all the healing processes which you define. You did mention about this part of herbs. Sometimes we have patients who are diagnosed, they choose to go the natural way. What do you have to say as far as that is concerned?
Now, even in the Western world, most medications came from herbs. Now, herbs, they do work. But the problem with herbs is the dosage, you don't master. The side effects, you don't master. That is the problem of herbs, but they are equally effective.
Okay.
Now, the Western world medicine and naturopathy, all of them work for one purpose, to bring health or
to treat.
help people. So it's not something to say this one is better than the other. Both need to be blended to be able to help everybody.
Okay. All right. This is quite interesting that you didn't have to, and now you're actually still taking some of them.
Yes, I'm still taking some of them.
All right. So you're watching us maybe from your sick bed and you're thinking that all is lost. Well, I hope you're not. You're inspired by her story because she has gone through the same pain. She has gone through the same hurt. She has gone through all of what you're going through, the psychological trauma, but she was able to pick up, and then with the support of her loved ones and the appropriate medication, she is here to share with you how she survived, and she's surviving this phenomenon. So I hope you get inspired by this story. So with you, I want to finish up here on set. On a summarily, doctor, you've told us it is not only about women, even men can have breast cancer. Can you just throw more light a little bit so that people can understand? Because the whole of this month, people are more of the look at the women, and leaving out the men. So it's, you said it's possible that men too can have. So can you throw more light on that?
Breast cancer in a man is very rare. Like very, very rare. It's not common, but
But
does
it's
exist,
possible.
But it does. I think I've seen just one person who has had that. Unfortunately, he passed away from the breast cancer.
Unfortunately.
Now, it's the same presentation like a woman.
All right.
We males will have breasts too, but they're not as developed like the females. It's the same presentation, lump on the breast. The same thing. He came to the hospital because he felt a lump around the breast. And that's how he did a biopsy and was found it was a breast cancer.
Okay.
So the same way it presents in a woman is
It's
the same way it can present in a man.
So the men as well should check often.
Definitely.
So it's not all about women, but I think the men too, sometimes you have to check, palpate your breast to see if you have a nodule, and if you see one, make sure you go contact a doctor. Now, doctor, another question. Some people think that this breast cancer is hereditary.
It is.
It is.
It's part of the counseling. If you have a first relative who has breast cancer as a woman, you should, as from 35 years of age, do a mammogram.
Okay.
It is important because it runs in some families. As I said, it's a matter of probabilities. If you have a first relative with cancer, your chances to have a breast cancer is higher. It doesn't mean you're going to have, but you have a greater chance to have a breast cancer. So if my mother has a breast cancer, my sisters should at least around that 35 years old do a mammogram to check to make sure they have not developed a suspicious lesion. Yes.
Okay. All right. So now we have a better understanding, and I want to talk again with you, Lady T. You've went through all of these, and one of the reasons why you've chosen not to show your face but to inspire one another, we appreciate that. But I want to find out from you, having gone through these different steps, having gone through the healing and the medication and the support you've had from your loved ones, what message do you have for people who are watching you right now?
I just want to encourage them that they should never lose hope. If you are being diagnosed with breast cancer, it's not a death sentence as it may sound, because fear, first of all, can just bring down your immune system that it will not respond to any form of treatment. Fear. The first thing I would advise them, they should remove fear. If they diagnose you of breast cancer or whatever cancer, just trust God and know that God is going to do it for you. Okay. And secondly, you should avoid the things they have asked you to avoid. Me, I am not eating meat. Meat of any form, I'm not eating it. And sugar and flour, bread, I don't eat it. Yeah, because my doctor will tell me, even from the monastery, that bread, I may see it as it's nothing, but when after digestion or something, it turns out to be sugar. So if I'm not eating sugar in the physical, maybe eating in another form.
In a transformed
yes,
step.
So
all right.
They just stop me from all those things.
Okay, now that's actually part of the things which Doctor was explaining to us here. Now, Doctor, I want to find out, there's a question here for you. Good evening to all in the studio. It is B.I. from Munya. Thank you for bringing up this topic. Doctor, please, I wish to know the first stage of cancer. That is, how does one know she has cancer? Thank God for saving you, Mama. I think he's referring to that. We're thanking God for saving you. And to the doctor, she's finding out. So how do you get to know the first step of cancer? That's from one of our viewers.
Now, the first thing is, you have a lump, you do a biopsy. The first step is doing a biopsy of whatever lump you have on your breast.
Okay.
As I said earlier, that's the only way you can diagnose a cancerous tissue.
Right.
You can see physically, you can say it can be cancer, but the only way to say this is cancer is through a biopsy.
Through a biopsy to confirm that it is cancer is the biopsy. So if you check your breast and you have a lump, go to the hospital, and then it's only when they have done a biopsy that they can say, okay, yes, it is cancer, and maybe determine the stage of the cancer. Now, doctor, one of the key things which you said is the fact that increasingly we have the number of cancer cases increasing because of what we consume. Like almost everything we consume today is processed food. So indirectly you're advising us to go back to the natural way, or to limit our consumption of processed food.
Limit our consumption, I would say. If not, if you want to go to natural way, there are very few natural things now available.
Okay.
So we have to limit and have to have a good lifestyle. The lifestyle is very important, not just for cancer, but many other diseases.
Okay, all right. Fortunately, because of time, we are going to draw the curtains of today's edition of the show. I think Lady T has had her words of encouragement to anybody who has been diagnosed of cancer or any disease, that there is still hope so far as you believe in God. So I want, with you, doctor, what message do you have for our viewers, both those who are watching us who have not been diagnosed yet, or those who are living with breast cancer? What message do you have for them?
I think, as I said earlier, the first step for anything, if you have cancer, early detection, better chance to survive.
Okay.
So self-breast exam for everybody is very essential. At home, always try to touch your breast to make sure you have no lump, and if you have one, you seek for health care.
Okay.
Now, for those living with cancer, it's just to give them like a word of courage. It's not easy, but they need that courage, they need that strength to be able to fight the disease.
All right. Thank you all so much. We hope you did enjoy today's edition of the show. It is on that note that we draw the curtains of today's edition of Women's Voice. If you missed out, do check Divine Mercy Radio and Television services on Facebook and DMR TV online on YouTube, where we're streaming this edition of the show, or you catch the rebroadcast on Saturday as from 8:30 p.m. In the meantime, we leave you in the company of more interesting programs coming up next on Divine Mercy Radio Television. From my end to yours is goodbye.